The average human being has some 100 hairs on their head, with 50 to 100 hairs lost per day. Our hair plays a crucial part in our lives. Having hair that is healthy has impact on our overall appearance and well-being. It not only enhances our physical appearance but boosts our confidence. It also is an indication of our overall health. For these reasons, it is quite alarming for most of us when we start to experience excessive hair loss. For that reason, we are going to tackle some of the main causes of hair loss. Reason number one is aging. As people age, there will normally be hair loss and hair thinning. The natural process of cell growth and death is present at all ages, but with age, more cells die than regenerate, which leads to less hair as the years go by. As people age, they also produce less oil in their scalps, which makes the hair brittle and easy to break, leading to hair loss. As the years go by, some people may experience a more severe hair loss due to their genetics and family history, which leads us to our second cause. Reason number one is family history. The most common type of hair loss is gene related and better known as androgenetic alopecia. In scientific circles, it is associated with aging. It affects tens of millions of men and women, though it affects the two genders differently. With men, it often starts at the temples and expands to the top of the scalp. Sometimes there is also a little thinning of the hair at the top of the head. And with females, hair loss usually begins where hair is divided but gradually thinning all over. Reason number three, hormonal changes. Hair loss due to hormonal changes is more common in women. Examples include conditions such as polycystic ovary syndrome and congenital adrenal hyperplasia, where there is high androgen levels, which leads to female pattern hair loss. These are usually associated with symptoms such as acne, excessive hair growth on the face or body. Other conditions which cause hair loss due to hormonal changes are pregnancy, childbirth, menopause, and hypothyroidism. Reason number four, stress. People who experience high levels of stress or high levels of emotional trauma can experience a condition called telogen effluvium. People suffering from this might feel that they are going bald. Usually, it begins 2 to 3 months after suffering a stressful physical or emotional event and peaks about 4 to 5 months later. Over time, the body readjusts and hair gradually stops falling out. Examples of stressful life events include losing a loved one, going through surgery, or being diagnosed with a serious illness. Reason number six, autoimmune disease. Inflammation in the body due to autoimmune conditions causes damage to healthy hair follicles, causing hair to fall off. The two most common autoimmune conditions that cause hair loss are alopecia areata and lupus erythematosus. In alopecia areata, leaves a characteristic cone-sized hairless patch. It can show all over the body and has no cure, but in most cases, the hair comes back on its own over time. There are different treatments like steroid injections that help hair to grow back faster. Reason number seven, infections. Infections can affect the scalp and cause hair to fall out. This happens when bacteria, yeast, or fungi overgrow and invade hair follicles. In cases of infection, you might see pus, bumps, redness, and scaling. The scalp can feel itchy or even painful. Fungal infections of the scalp are highly contagious and they are the most common cause of hair loss in children. Most scalp infections are curable with the right antibiotic or antifungal medication. And reason number 8, medications. Temporary or permanent hair loss can be caused by several medications, including those for blood pressure problems such as captopril and lisinopril. Medications that treat heart disease and cholesterol such as atorvastatin and simvastatin. Steroids such as testosterone and progesterone, and medications used for gout, for example, colchicine. Reason number 9, hairstyles. Some hairstyles can cause damage to hair follicles, leading to hair that can't grow back. Hairstyles that pull the hair tight, examples of this are pigtails and cornrows, can cause hair loss called traction alopecia. Excessive chemical treatment and also some shampoos that contain the chemical formaldehyde have been linked to hair loss. Reason number 10, chemotherapy and radiation. People who receive chemotherapy and radiation also experience hair loss, but fortunately, with both types of treatments, hair loss is generally temporary. And finally, nutritional deficiencies. In some cases, hair loss can happen because of nutritional deficiencies. Low levels of iron, vitamin D, and zinc have been linked to hair loss. Generally, dietary supplements usually reverse hair loss by correcting any vitamin deficiencies, though a blood test is needed before using a vitamin supplement. So, to recap, we have mentioned some of the most common causes of hair loss, and they are hair loss that is gene related, hair loss due to advancing age, due to hormonal changes, stress and emotional trauma, autoimmune disease, infections, medications, hairstyles, chemotherapy and radiation, and finally, nutritional deficiencies.